Hello, this is Dr. Beach, and with the transition of seasons, patients are often coming in with a cold. And today I want to talk a little bit about how we treat a cold and actually what the mechanics are to actually catching a cold. Have you noticed that people get colds most often in the early fall, winter, and then again in the spring? But definitely when there's a change of season going from the summer to the fall to the winter, and from the winter to the springtime seems to be the times when people are most susceptible to colds. And this is the key, is that susceptibility. You see, the germs are there all the time. We can always get an exposure to a cold. Granted, during the school year, people are crowded together in a small building many times. And even in the wintertime, people are crowded together. So there is more exposure during those times. But in order to get an infection, you have to have both exposure plus susceptibility to equal the disease. So something that we can control is our susceptibility. So in other words, allow our immune system to function properly. Now, there are certain things that are general points about keeping the immune system strong. Certainly good diet, eating fresh food, using spices in the food, cooking with prebiotic ghee, which helps the immune system, and using probiotics in terms of yogurt or lassi, or using Natron probiotic to keep the immune system strong. But another thing in the mechanics of how we get a cold is that when the seasons change and the weather gets cold, it causes constriction, vasoconstriction and constriction of the sinuses. And as these tissues constrict, then they are not allowed to flow in terms of the mucus flowing through the sinuses. Now, we're in a season that's cold and dry, and so the sinuses are more dry, and the body then reacts to that dryness by producing more mucus. So it's making more mucus, and yet the channels through which that mucus has to flow, which is flowing into what's called the lymphatic system in the neck. In the front of this muscle here, there's an anterior lymphatic chain, and in the back of this muscle, there's a posterior lymphatic chain. And so that mucus then flows into the lymphatic system. The lymph system then drains any infection through, fights the infection, and then it eliminates it through the bloodstream. So what can happen is that because of the cold weather, we're making more mucus because of the dryness, and the channels are more constricted, especially if we're not taking good care to keep the channels open, such as going outside with our head exposed or our neck exposed to the cold weather, which causes that type of constriction, and then the general dryness of going in and out of heated rooms. That sets up the conditions for us to get a cold. Another thing that I see a lot, and I have to mention it, is people coming in with their head wet. Washing the hair and then not drying it before going outside in the cold, and then not even wearing a hat. That's not an old wives' tale. That is a good way to get sick for the reasons that I'm just saying. So what can we do to combat that? Keep the head warm. Always wear a hat in the cool weather. Wear a scarf. Keep the neck covered as well. And then there's a product that we use called Cough and Cold. This is one of our Ayurvedic products. It's a transdermal cream. And it has two main ingredients in it. One is tulsi. Tulsi is holy basil. And holy basil is a very, very good herb for supporting the immune system. And then the other ingredient that's very good in this is peppermint. So it has some peppermint that opens the channels. So it opens the channels and then delivers an herb that supports the immune system. And so what you do with cough and cold is apply it, what I have my patients do, is apply it right in front of the ear and down along the base of the jaw. Here because it helps to open the eustachian tube, and here because of the submandibular glands that often get involved in an infection. And then down the front of this muscle that comes from the back of the ear down to here, which is called the sternocleidomastoid muscle. Right down the front of that muscle and down the back of that muscle, you apply some cream And then just swipe down that area about 7 times, front and back. And then there's a special point that's in Ayurveda known as a marma point. This point is called kant, which means throat. And with the fourth finger, we would apply some cream there in a clockwise fashion. Clockwise is always as if you put a watch on your skin, whichever way that watch is going. So if I put a watch here, clockwise is going to be this way. So clockwise, like that, 7 circles. And then you can also, if there's any congestion in the maxillary sinus or in the frontal sinus, you can just apply some on the nose, right here on the side, and across the top, both of those areas. And this works very, very well. I recommend using it when you first start even feeling a symptom of a cold, feeling a little fuzzy, fatigued, maybe your throat's a little scratchy. Start right away. The sooner that you are able to start that treatment, then the quicker or more likely you are to prevent the cold from ever manifesting into something more, something more severe. So I really encourage you to use this product. It's a good thing to just keep in the house all the time. We used to call it children's cough and cold, but we found out that everybody needed it, so we just changed the name to cough and cold cream. And recently I had a patient who came in with a cold and didn't really know anything about Ayurveda. We'd never really discussed Ayurveda with her before she came in for some other problem. But I mentioned to her this product and she tried it and she had remarkable results and she was very impressed by it. Her name is Jean, and I wanted to show you a quick video of her and let her explain what her experience was in using it. So thank you very much, and I hope that this helps. Take care.
Okay, so my normal cold routine is Tylenol and Sudafed constantly, Tylenol, Sudafed, and using the cream.
Which cream did you use?
The
cough and cold.
The cough and cold. Cough and cold. I never got that painful congestion in my sinuses. I had to use a lot of Kleenex because I was blowing my nose a lot, but I felt so much better. And the cold did not last it lasted about half as long as it normally does. So I'm like incredibly amazed
Excellent.
and grateful.
I'm glad it worked.
Yes.